Hello and welcome to episode 40 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with the RehabFix online low back program. And today's topic is what your surgeon is getting wrong about stenosis, or provider or therapist or whoever. Stenosis can be a very misunderstood thing because it is typically overly simplified. And we're going to dive into one of the biggest mistakes that people are, or providers are telling individuals with stenosis, or that people with stenosis are making the mistake of falling into. Last episode 39, we discussed how your treatment sessions don't really matter, and how if you are solely relying on the 30 minutes a week at your chiropractors or physical therapists to get you better, that you unfortunately might be mistaken, and that ultimately you have to hold yourself accountable for putting in the work, for changing your habits, changing your lifestyles. And that amount of face-to-face time that you're getting really does not make a difference in the grand scheme of things, because you need to simply have the right information and you need to apply it within yourself, and that no one can do the work for you. So if this is a topic that you maybe have been struggling with, I encourage you to go listen to episode 39. But for today is all about stenosis. So first off, let's define stenosis, okay? Stenosis, that word itself simply means narrowing. Stenosis means narrowing. Now, when someone says, I have stenosis, of course, essentially they're saying, I have narrowing, but of course that typically refers to two different regions of the spine. That's my cell phone if you heard that. The central canal. I just silenced my phone. Sorry for those of you who are listening or watching. The central canal can have spinal stenosis, so where the spinal cord goes through, or the IVF, the intervertebral foramen. Those are the two regions that typically would refer to someone saying, I have stenosis. One of those two regions are narrowing. So this could be termed as, arthritic changes, right? Some bony overgrowth is starting to narrow those canals. Sometimes part of the degenerative process. That's usually how it's termed. But even people in younger ages are being told that they have stenosis, and sometimes that's correct, sometimes it's not. But the point of today's podcast is to help you understand that many individuals that are told they have stenosis, whether they're 30 years old, whether they're 70 years old, are told one common thing. And this is the mistake. This is the huge mistake. Everybody with stenosis is told to avoid extension. All of them. So why is that? For those of you who are watching on YouTube, you'll get to see this demonstration. For those of you listening, you won't get to, but you can listen to to the best descriptive examples that I can give at this time. But we have our spine model here. These IVFs, or even the canal itself, the central canal. When someone goes into extension and they lean backwards, you can see those facet joints, also called the zygapophyseal joints. There's a fun word for you. The facet joints essentially close in on each other further, thus narrowing the IVFs, narrowing the opening that the nerve has to go through, and potentially closing in on the central canal. So here's the mistake that everyone makes. They look at these spine models and they do this extension. They go, oh yeah, like I can see that. I can see, extension narrows the IVF, extension narrows the central canal. People with stenosis, they shouldn't do that. So never do stenosis. You're not going to, or never do extension. Never do extension. People with stenosis never do extension. Extension is the devil. Extension is going to ruin you. There's even something called a shopping cart sign, where individuals who are in their later stages of life might find themselves leaning over their shopping cart to make it through the grocery store, because flexion opens up the central canal, it opens up the IVF, and that's why they're doing it, which is true. This is true, but once again, here's the mistake. Oh, flexion makes it better standing up. is more extension. That makes it worse. They need to avoid extension and only do flexion. So people with stenosis, never do extension. It's the devil. Only do flexion-based exercises. Many surgeons, never do extension. Extension is a terrible idea. My clients have been told this before. After I recommended them otherwise, went to their surgeon. Oh, but my surgeon said to never do this. And unfortunately, that becomes a tug of war of authority, right? That's a very frustrating situation to be in. You're saying this, but my surgeon is saying this. I don't know what to do. I make this very simple for my clients. I just say, well, try it and let me know how you feel. Let's let you be the boss, okay? Don't do something just because someone said not to. That's not a good reason. That's not a good coaching method, right? Like when I advise my clients to do something, I explain to them why. And then they do it, and if it feels good, they keep doing it. If it doesn't, then we find something different to do. It's as simple as that. So many people with stenosis told to avoid extension. There are so many individuals I've worked with who have been told, yes, Grant, I have stenosis. I was diagnosed with stenosis. I was told to never do extension. And I go, all right, well, we're going to go ahead and do extension then. And they go, what? Are you kidding me? They're shocked. They're surprised. Like, but extension hurts. And I go, okay, that's fine. We're going to do it. But my surgeon said to not do extension. All right, that's fine. We're going to do extension. It's surprising to them. And the reason why is because I don't let myself nor my clients be controlled by labels. Okay? Just because someone tells you, oh, you have stenosis, it immediately doesn't mean that you can't do X, Y, or Z, or that you should do X, Y, or Z. There's no cookbook recipes for these things. And that's the problem with stenosis, is people treat it like it is. People treat stenosis like a cookbook recipe. Take an MRI, take an X-ray. Oh, we see narrowing. Okay, that means extension bad, flexion good. No, that's a cookbook recipe. That doesn't work for anybody. But everyone's told the same thing. So I say, hey, you know what? I understand that when you stand up straight or lean backwards, it can cause some sciatica to go down to your leg because that's stenosis. I understand that. I hear you. We're going to make sure that nothing we do makes that worse. So when I'm going through an assessment with someone, I might have them bend forward to touch their toes, or at least as far as they can. They might say, oh yeah, it's a little bit achy. Might have them lean backwards as far as they can. Oh yeah, that doesn't feel comfortable. That's really, really stiff. It feels like I can't go very far. It causes sciatica down my legs. Okay, no problem. We go into some extension-based exercises. Some of these might look like resting on your stomach, propping up on your elbows, or even going to some cobra type poses, but not for long. Some people, they respond better to holding it. Others don't. Some respond better to partial ranges of motion. Some don't. Some respond to full range of motion. Some don't. I'm not going to really go into detail on this because this is what the assessment is for. You need guidance for this, okay? I just want to be very clear. But we go through extension-based movements. We retest their assessment. They do their standing back bend. They do their extension, and they're like, oh my gosh, I don't feel as stiff. I can go further. There's less sciatica down my legs. And I'm like, yep. But I was told to never do these. Yep. That's the frustrating part. That's the frustrating part. All of the time, people with stenosis are told to avoid extension because the cookbook says not to. But all of the time, that's the very thing that I find makes them better. Now, this isn't for every person. Once again, I'm not a cookbook either, right? There are some people with stenosis where end range loading into extension is not going to help them. But the point of this podcast is that for many, it does. And for many, they're told to never do that. So all the time I talk to individuals who are told by their providers to not do things, and very often those things that they're told, because the cookbook says so, is the very thing that could help them recover. Their textbook in school, their professor that's been teaching the same thing for the last 20 years and hasn't revised it at all, says to do these and don't do these. And so they just repeat that. Oh, you have stenosis, you have this label, you have that label. Do this, don't do this. So they say, okay, my doctor said so, my surgeon said so, my therapist said so. But then the very thing they were told not to do is the thing that could end up being the most effective thing for their recovery. And this is what's really frustrating. This is the way it is for many, many conditions. Many conditions. Disc herniation, sciatica, other hip dysfunction related things. But stenosis just happens to be the classic. Extension bad, flexion good. No. Almost every single person I've worked with stenosis, I've gone through extension progressions with them, which were initially painful, which initially did not feel great. But guess what? It ended up being the very thing that restored their extension, that reduced the sciatica, that improved their range of motion, that reduced their pain. So don't follow these cookbooks, okay? This is the biggest thing that people get wrong with stenosis, as well as many, many other things, many, many other diagnoses. Don't allow yourself to be treated like a recipe, and don't accept recipes. I encourage you to question the people that you're working with and to always get other opinions as well, because this sort of situation happens far too often. So this is what surgeons and providers are getting wrong about stenosis. This is the myth busting for stenosis today. I hope that this opened your eyes potentially and gave you a little bit of a counter argument if you've been told some things in the past. And as always, if you or someone you know has been struggling with low back pain, disc herniation, sciatica, or been told they have stenosis, please share this with them. If you would like my help, submit an application using the link on my website or in the description of this post so that you and I can have the chance to meet one-on-one and work together to determine what will truly work for you and to not follow any cookbook recipes so that you can get the structured plan you're looking for that's made for you. Please share this podcast, rate this podcast as well if you'd be willing to take that time. It's a free way to give back. If you'd give us a 5-star rating and review if you feel as though we deserve it. And on YouTube, if you would like, comment, and subscribe to help boost this video on the algorithm so we can help spread this information to more people to bust these myths about stenosis, as well as many, many other diagnoses to help individuals learn how to become equipped with knowledge and how to fix their low back so they can get back to 100% quality of life. And as always, move more, move in nature, and move in the sun. Thank you so much for listening, and have a great day.